According to estimates, 34.2 million Americans of all ages have diabetes, both diagnosed and undiagnosed. Diabetes can cause blood sugar levels to rise if it is not continuously and carefully managed, which raises the chance of serious side effects like heart attack and stroke. There are numerous types of diabetes, and each has a unique management strategy. Not all types of diabetes are brought on by obesity or a sedentary lifestyle. Some have existed from childhood. Here in this video, we will discuss diabetes, its causes, symptoms, preventions, and solutions. The video is going to be very interesting, so make sure you stick till the end. Before we continue to our video, make sure to smash the like button, subscribe to our channel, and hit the bell icon to never miss any of our future uploads. Now, let's get started. Diabetes types. There are several varieties of diabetes. Number 1. Type 1 diabetes. Diabetes type 1 is an autoimmune condition. The immune system targets and kills insulin-producing cells in the pancreas. Uncertainty surrounds the attack's origin. Number 2. Type 2 diabetes. As your body gets resistant to insulin, type 2 diabetes develops and blood sugar levels rise. It accounts for roughly 90% to 95% of cases. Trusted type 2 diabetes is a source of diabetes in humans. Number 3. Type 1.5 diabetes. Latent autoimmune diabetes in adulthood is another name for type 1.5 diabetes, LADA. Like type 2 diabetes, it develops gradually during maturity. LADA is an autoimmune condition that cannot be controlled by a healthy diet or way of living. Number 4. Gestational diabetes. Diabetes gestational is excessive blood sugar when pregnant. This form of diabetes is brought on by substances the placenta secretes that block insulin. While having a similar name to diabetes mellitus, the uncommon illness known as diabetes insipidus is unrelated. Your kidneys are removed from your body too much fluid in a separate ailment. Different diabetes types have different signs, causes, and treatments. What are the root causes of diabetes? Diabetes, in whatever form it takes, is caused by having an excessive amount of glucose circulating in the bloodstream. However, the reason why your blood glucose levels are so high is going to be different depending on the type of diabetes you have. Some of the following can lead to diabetes. Number 1. Insulin resistance. Insulin resistance is the primary factor in the development of type 2 diabetes. Insulin resistance is a condition that occurs when the cells in your muscles, fat, and liver do not respond to insulin in the appropriate manner. Insulin resistance is caused by a number of factors and situations, including obesity, a lack of physical exercise, food, hormonal imbalances, genetics, and some drugs. The degree of insulin resistance can range from mild to severe. Number 2. Autoimmune disease. Both type 1 diabetes and latent autoimmune diabetes are caused by an attack on the insulin-producing cells in the pancreas by the immune system. Number 3. Hormonal imbalances. The placenta is responsible for releasing hormones that contribute to insulin resistance throughout pregnancy. If your pancreas is unable to produce sufficient insulin to overcome insulin resistance, you may develop gestational diabetes during your pregnancy. Acromegaly and Cushing syndrome are two other hormone-related diseases that have been linked to the development of type 2 diabetes. Number 4. Pancreatic damage. The inability of your pancreas to produce insulin can be a symptom of diabetes type 3 if it has been damaged physically, which can be the result of a condition, surgery, or injury. Number 5. Mutations that occur in genes. MODY and neonatal diabetes are both potentially caused by the same genetic abnormalities. The use of some drugs, particularly HIV/AIDS treatments and corticosteroids, for an extended period of time increases the risk of developing type 2 diabetes. Symptoms of diabetes. The symptoms of diabetes are brought on by an increase in blood sugar. Indications in general. The symptoms of type 1 and type 2 diabetes are identical. However, type 1 symptoms appear more quickly than type 2 symptoms. The emergence of type 2 diabetes is typically more gradual. Nerves that tingle and wounds that heal more slowly are more common in type 2 diabetics. If type 1 diabetes is not managed, it can lead to diabetic ketoacidosis if the condition is not treated. When there is a potentially harmful number of ketones in the body, this condition exists. Even though it occurs less frequently in other forms of diabetes, it is still a possibility. The following are some of the general symptoms of diabetes: an increase in appetite, an increase in thirst, a loss of weight, frequent urination, blurred eyesight, intense exhaustion, and wounds that do not heal. Signs in men. Men who have diabetes are at an increased risk of experiencing a diminished sex desire, erectile dysfunction, and inadequate muscle strength, in addition to the normal symptoms of diabetes. Signs in women. Dryness in the vaginal area, urinary tract infections, yeast infections, and dry, itchy skin are some of the symptoms that can occur in women who have diabetes. Gestational diabetes. The vast majority of pregnant women who develop diabetes do not experience any symptoms. When pregnant women go in for their routine blood sugar tests or oral glucose tolerance tests, which are typically administered between the 24th and 28th weeks of their pregnancies, medical experts frequently find evidence of the condition. In unusual instances, a woman who is pregnant with diabetes may also suffer an increase in the frequency or volume of her urination or thirst. Preventions for diabetes. Diabetes type 1 cannot be avoided in any way. However, the same changes in lifestyle that can help treat prediabetes, type 2 diabetes, and gestational diabetes can also help prevent these conditions. Number 1. Consume only nutritious foods. Pick foods that are lower in fat and calories and higher in fiber rather than vice versa. Put your emphasis on fruits, vegetables, and grains that are whole. Consume a wide variety of foods to prevent feelings of monotony. Number 2. Participate in more strenuous activities. Make it a goal to participate in some form of aerobic activity for approximately half an hour on most days of the week. Or set a weekly goal of engaging in aerobic activity for at least 150 minutes at a moderate intensity. As an illustration, go for a brisk walk every day. If you are unable to commit to a lengthy workout session, you should instead break it up into several shorter sessions that you perform throughout the day. Number 3. Lose excess pounds. If you are overweight, losing as little as 7% of your body weight can significantly reduce the likelihood that you will develop diabetes. A person who weighs 200 pounds, 90.7 kilograms, for instance, may be able to reduce their risk of developing diabetes by losing 14 pounds, 6.4 kilograms. You should not make an effort to reduce your weight while you are pregnant. Have a conversation with your healthcare practitioner about the appropriate amount of weight gain for you to have during your pregnancy. Work on making modifications to your food and exercise routines that are meant to be long-term if you want to maintain a healthy weight. Keep in mind the many advantages of achieving a healthy weight, such as having a healthier heart, greater energy, a diabetes solution. The treatments that you require are determined by the type of diabetes you have, any other health conditions that you have, as well as how well you manage your glucose levels. The following components may be included in the treatment plan for diabetes type 1, type 2, or gestational diabetes. Number 1. Insulin. If you have type 1 diabetes, you will have to inject yourself with insulin on a daily basis in order to keep living. This is due to the fact that your pancreas is no longer producing insulin. Insulin is necessary for the treatment of type 2 diabetes and gestational diabetes in a significant number of patients. Insulin can be administered in a number of different ways, including through the use of a vial and syringe, a pen and pen needle, a pump, an injection port, a jet injector, an inhaler, or a device that is referred to as an artificial pancreas. Number 2. Different pharmaceuticals. Some persons who have type 2 diabetes or gestational diabetes require oral drugs or other treatments that do not include insulin in order to successfully manage their condition. These are not effective treatments for type 1 diabetes. Around 30 oral and non-insulin injectable drugs have been given the green light for use in the treatment of diabetes by the Food and Drug Administration, FDA, of the United States of America. Insulin is compatible with the usage of several of these other medications. Number 3. Blood sugar monitoring. It is very necessary for people who have diabetes type 1 or type 2 who use insulin to monitor their glucose levels with a blood glucose monitor or continuous glucose monitor, CGM. Because it displays your glucose levels over the preceding 2 to 3 months on average, your doctor will probably want to check your A1C on a regular basis as well. Number 4. Good quality sleep. The majority of health issues can be resolved with a good night's sleep. Get at least 8 hours of restful sleep every night to keep your diabetes under control. It improves your ability to unwind and is good for your mental and physical well-being. Lack of sleep can make your issues worse because it can lead to weight growth, impaired brain function, insulin sensitivity, and elevated blood sugar levels. Always keep in mind that having a regular sleep schedule can help you manage excessive blood sugar levels in your body. Number 5. Manage stress. Stress can cause high and unmanageable blood sugar levels in diabetic individuals. Remind yourself to manage your stress through yoga, exercise, and meditation if you want to control your diabetes. Additional strategies include spending time with close friends and family, making an effort to reflect rather than worry about current events, etc. Hope you guys enjoyed our video. Make sure to subscribe to our channel and hit the bell icon for more videos. Thanks for watching and have a wonderful day.